Thanks very much for that, Gillian. And can I start by acknowledging the traditional custodians of the land on which we gather, and I pay my respects to their elders, both past and present, to my parliamentary colleagues and patrons. Greg Hunt, who I see up the back, Jill Hall, Mark Coulton, Senator Urquhart and Senator Stewart, who are here with us, Jeff Lyons and Nola Marino as well. Thank you so much for joining us. But more importantly, how fantastic that you're all here. It's just wonderful. And sorry, and also Gary Humphries, I just saw at the back there. My apologies, Gary. But welcome to Parliament House for those of you who have not been here before. Can I tell you, Gillian has been here many times, many times, both in my office and the many members of Parliament advocating your case. So I welcome her and thank her very much. Can I also say to John, John's been a fantastic advocate for your organisation and continues to be so, and I want to thank him for the work that he's been doing for the organisation as well. I'm really pleased to be able to join you here today for the launch of the first ever module of Polio Australia's new online resource on the late effects of polio. The new information for health professionals and the community is going to be really valuable in raising awareness of the lingering effects of polio in Australia. The last reported case of locally acquired wild polio in Australia was in 1972. Only 24 years ago, in 1988, there was still more than 125 countries in the world where polio was endemic. That number is now down to 3, which means the risk is reduced, but certainly not yet eliminated. That's why we continue to include polio vaccination as part of routine childhood immunisation. It is listed on the National Immunisation Program schedule and is provided free by the Australian Government for children at 2, 4 and 6 months and 4 years of age. Australia, because of that immunisation program across many successive years, has officially been declared polio-free by the WHO in 2000. But that does not mean that we are no longer feeling the effects of polio, as you well know. Most Australians who caught polio did so during the epidemics of the 1930s, 1940s and the 1950s, before an effective vaccine was introduced. My mum was one of those. There are many of them now over 50, a quarter over 60, and many, like my mum, in their 80s. There are also a significant number of younger Australians who contracted polio overseas before they came to live in this country. But even as the number of new cases of polio have rapidly declined, it's become clear that the effects of polio are greater and longer lasting than previously believed. Researchers have discovered that many people who survived polio when it first touched them had developed a new wave of symptoms 15 or some 20 years later. And these, of course, are the late effects of polio, or in a more serious form, post-polio syndrome. Doctors and researchers still have much to learn about the late effects of polio. As only 1 to 2% of people who get polio are paralysed, this means that there are large numbers, many tens of thousands in Australia today, who could potentially develop late effects of polio, including the more severe symptoms. In turn, it makes it really important for GPs and other doctors and therapists to know about the late effects of polio and post-polio syndrome, so that they can make the correct diagnosis and provide the right treatment. It is particularly the case as some polio survivors may be unaware themselves that they even contracted polio because they were very young at the time or they had very mild symptoms and were never diagnosed. The online information resource will help to draw attention to the issue, which is a very pressing one for those people who are affected. Polio Australia's vision is that all polio survivors in Australia have access to appropriate health care and the support required to maintain independence and make informed lifestyle choices. It is a vision the Australian Government shares with you. We are certainly committed to reducing the burden of all types of chronic disease, and we support your efforts to ensure that adequate diagnosis and treatment is available to people developing late effects of polio. In relation to specific actions on late effects of polio, as most of you know, the House of Representatives Standing Committee on Health and Ageing released a discussion paper on the late effects of polio and post-polio syndrome last July. An excellent report, and one I know was championed very strongly by that committee. I was particularly interested in the committee's recommendations on that Medicare locals should promote awareness of the late effects of polio and post-polio syndrome, working closely with Polio Australia and state-based polio associations. A further point raised by the committee, which I and the government can endorse, is the need for increased education and awareness of the late effects of polio and its implications. This new online resource will go a long way to helping fill an information gap for health professionals and for people who may be at risk of developing the late effects of polio. I want to particularly congratulate Polio Australia on its initiative, and I have no doubt that it will make the continuing polio journey, hopefully, a little easier for many of the Australian polio sufferers, their families and their carers. And hopefully we won't hear some of the quotes that Gillian has said coming from from the experiences with health practitioners as they start to use this online resource. So again, congratulations. I know you're coming to question time today, and I think your presence here in the House is a very, very important development in making sure that people across the country, that MPs and senators are aware of the late effects of polio and the impact and just how widespread it is within our own communities. So again, thank you for coming here, and it's with great pleasure that I officially launch the Late Effects of Polio Introduction to Clinical Practice. Well done.